Thanks so much for joining me on the Slice of Healthcare podcast. How are you today?
Doing great, thanks.
Great. I'm excited for us to have the opportunity to speak. I think we should dive right into it. I'd love if you could tell the audience a little bit about your background.
Great. So my name is Ted Quinn. I'm the CEO and one of the co-founders of Activate Care. We have been working for the last 8 years on thinking differently about healthcare delivery and how you connect the disparate caregivers and communities that often sit outside of healthcare, behavioral health, social care providers. And so my background's in technology and trying to think about new care models and new ways of thinking about how we meet the needs of individuals and families.
And you've been doing this for a little while now, right? You've been at the company now for, 8 years?
8 years. Yeah, we started back in late 2012, early 13. Myself and two physicians over at the Boston Children's Hospital, Harvard Medical School, Zach Kohani and Ken Mandel, and then Clayton Christensen over at the Harvard Business School. Each one of us had been kind of impacted by the challenges of working with either loved ones or friends who had fairly complex health situations. Sometimes they were clinical, sometimes they were a mix, right? Clinical and other services and other needs. And how do you enable all those different stakeholders, if you will, or caregivers, see each other and be aware of what needs to happen or what an individual or family is trying to make happen in their lives, and how can we provide a shared space where those caregivers across the community can work together to achieve those goals. That's kind of our mission.
What was it like working with those initial people? So over at Boston Children's Hospital, and then you said Clayton Christensen.
It was interesting. We're fortunate that Clay, Zach, Ken, they're very well known in business and disruption and in healthcare technology. When we started, it's been an interesting journey. We tried to be a little simpler in our approach and say, boy, could we just focus on the clinical setting, and Clay was the poster child for this. He was very open about it, right? Cancer survivor, stroke, heart attack, diabetic, a range of health challenges over the course of his life. And who owns that problem? Well, Clay owns that problem. And it's hard in healthcare for those different silos. The incentives and the workflows don't necessarily align. And it's not a criticism of healthcare, it's just the reality. But we quickly learned that those stakeholders are kind of embedded inside the electronic medical record. And so we continued to kind of move to say, how can we think differently about our care delivery and our solution? And we quickly realized that having these disparate caregivers that often sit outside the walls of the clinic, engaged and involved around what the goals the individual has. And I think that's another important lesson learned for us, is that you've got to focus on what, if I were one of them, what Ted's trying to make happen in his life versus what I want to see happen in Ted's life. So enabling those goals to be surfaced was critical for us. And so we learned pretty early that you've got to think more broadly about care. That presents other challenges, but it's an important job to be done.
That's interesting. And before you were working on this, you were at, was it Vecna?
Yeah, Vecna Technologies.
How did your experience there? I feel like that's a very well-known company, especially amongst like the Boston scene, right?
Yeah.
How did your experience there help you in this?
Well, it was a really great experience. Vecna as a company is focused on a couple different silos at the time, right? They were in infection control and infection surveillance. They were looking at patient workflow, particularly as coming into a health system specifically, or a delivery system. They were looking at how you could apply things like robotics as part of more on the operational side versus the clinical side, but for the operations of a hospital or health center. And so they had these disparate kind of lanes they were swimming in. And it was, for me, a real rich opportunity to kind of better understand things like patient workflow and the role of EMR and other technologies, and thinking about integration and thinking about some basic operations of the hospital. But one of the things I kind of took away from that experience was the need to get really focused. And that's always a challenge with businesses, of how do you get really focused on a key job that such organizations are trying to make happen. And when you think about patient care, we often default to, well, let's look at their clinical care, or let's look at their payment with their insurers or their health care payer providers. And we quickly realized that there's a meaningful job in connecting the disparate organizations that are so central to the outcomes that we want to see, and often they're not clinical.
What was anything with the business affected as a result of, obviously last year was a crazy year, right, with the pandemic? Was like the work structure of your team, did everyone go, like, how was everyone liking in a remote structure? Do you think that'll still kind of continue for the company for some time, or are you going to maybe work on a hybrid? This is a question I've just started really asking because it's been one that's been coming up more in conversation, right? As, you know, I'm not saying the end of the tunnel is super near, but we're closer than we were last year, right? To getting out of this pandemic. What are like your thoughts on like the future of how your company will work?
Well, it's a great question, and something we've been talking about, but put more energy on more recently. Like most organizations, we went remote in the beginning of March of 2020. You know, our teams, we haven't been in person or in the office since that time. I go in, you know, every week, a day or two a week, just to turn on the lights and check the mail and that kind of stuff. But it's an interesting question because if you look at some of the data, right, the models that are emerging are going to be very interesting to see how it plays out. You know, some organizations are describing 40% of companies are going to go to some hybrid model, coming back in person, 50% some hybrid model, and 10% remote. And I'm not sure if those statistics are right, but those are the things that I've heard. For us, kind of moving to remote, it was amazing how productive different parts of the business or organization became. Just our ability to not have to commute an hour or two or plus every day gave people more time. That's had some trade-offs with a sense of connectedness and new employees that join the organization and a sense of kind of this family and team we're working together. I always worry about that. But I've also been concerned that kind of some of the hybrid models are going to be kind of lukewarm and not have the impact we want to see. So for us, we've been talking about, is there some model where we rotate through the office, or we have some number of days of the week we're in the office? But I don't see work going back the way that it was before. I just think we've been able to demonstrate that not only from an operating standpoint, you can be very effective with the technologies that we have today that we didn't have 30 years ago when I started my career, or it opens the door to a broader set of resources on a national level to find good people. And so we've seen that also, the ability to kind of source if we have a different operating model. So I think we're going to learn our lessons, and we're going to learn a lot over the next year or two as companies try to think through this model and what the model looks like. But it's clear from my perspective that it's not going to be the same.
I remember like commuting to, before I lived, so, you know, I no longer live there. I'm in Florida now, but I lived in Boston. And yes. I remember before that, I was commuting from New Hampshire to Boston every day. And what I was doing was I was driving like 30 minutes, taking a train 30 minutes. And then if I missed the train, which would happen based on lights, right, it's another 30 minutes. Yeah. So it would be anywhere from a 1 to 2 hour commute one way. So 2 to 4 hours of my day was just commuting. And I'd like to see, you know, how lower people's stress levels are. Obviously, there's different levels of stress now that you're home, because a lot of people, you know, that have children, it's even more, right? Because they're always with their kids, and they have to still do their job. Like there's a lot to balance. Yep. But yeah, I've been looking. I haven't seen many reports that said a company is going to go back full time in the office. I think that is gone.
Yeah. What's interesting, the other side of that is that the challenge can be is that you have work with you all the time. Right. At least the part of the benefit of going to work is that you have the separation, right? I'm in a different place, different setting. I could focus elsewhere, versus when you're working from home. I think there's to your point, the stress or the sense of anxiety is not only the busyness of activities that are going on in your home, but also the fact that work is always here or work is now here. And so it'll be interesting to see how those things play out for sure.
Yeah, we've seen people that end up working more than they probably would in an office, not because we're telling them or anything like that. They're just like, there's always something to do. I'm at home. I don't have to commute. And that's a challenge that needs to be monitored, right? Like you're saying, because people can still get overworked or stressed based on that. But Yeah, it's certainly interesting. We've also looked at maybe having like a solid co-working space, like in different
Oh, you have?
areas. Yep, and cycle through that. At least like give people the option if they need to get out of their house for 6 hours to go work in a quiet
Similar.
spot.
Similar.
Yeah. So I think co-working spaces will actually do really well post pandemic. Well, the ones that are still around, obviously some really got hit hard. But yeah, we'll take a look at that. Interesting. I want to circle back real quick because there's another thing I wanted to ask you before we wrap up. What are some of the things in terms of your business that you're really looking forward to in, well, we're already 3 months in, but in 2021?
Well, it's interesting. These kind of care models, where they're often referred to as community information exchanges, where communities, organizations are recognizing that these whole person care models, being able to enable all these stakeholders that are touching individuals to see each other and work together, that's a trend that I don't think we can take out of the box. I mean, the genie's out of the lamp there. I think that organizations and communities recognize that in order to see the outcomes we want to realize, we have to stand up these models of care. And there's been a headwind with COVID, right? I'm looking for PPE, I'm looking for body bags, I'm trying to get people vaccinated or tested. And I think as we see vaccinations continue to roll out, I don't think it's going away anytime soon, but I think you're going to see the attention turn to these types of care models. If anything we've learned through COVID, it's the reality that these other services have only been amplified, right? So if I'm positive and you want me to do the right thing, how can I do the right thing if I don't have a way to get food, or if I'm losing my home, or if I can't get to the doctors, or I can't go with my family member or loved one who's ill? So I think these things have exposed some of the challenges with our systems and recognize that such services and needs are really central to outcomes we want to see in terms of health and cost, the experience individuals and families have in their care, the providers and how they're recognized, compensated, and supported as people move through these more complex care. So I'm really excited about that because it's only just amplified the need.
And just so our audience knows, I don't want this to be the last time we speak. I want to have you and other members of your team on the podcast multiple times, hopefully this year, where we can dive into the other aspects of your business. This is really your intro podcast where we get to know you, the company, and some additional background. And then we get to also have a cool conversation about what we're going to do as far as going back to work, right?
Yep.
So I really appreciate your time and look forward to having you and other members of your team on the podcast in the near future.
Well, absolutely. Well, stay healthy. All the best.
You as well. Thanks.